Yeah, I gotta catch up on my farm lectures.
Oh yeah, I hear ya.
I still haven't watched one for like 3 weeks,
Yeah.
I think he's ready to start class,
Okay.
All right, team, how are we doing? Okay, before we get started today, let me ask, are there any burning questions? Haley with the questions!
Can you explain like a STEMI and the pathos behind it?
Oh, yes. We don't have any markers. Okay, thank you, Emma. All right. Pathophysiology. Okay, so what happens in a STEMI? So, when somebody's diets, when they eat a lot of fats, they have lipids that flow through their bloodstream, okay? And what happens to those lipids? Lipids come down, they go into your bloodstream and there's a subendothelium, okay? And they become cytotoxic. Okay, and what does that do? It starts, where is it? Your inflammatory activation, okay? So your monocytes come into your blood vessel, they take up these LDLs, and they become foam cells, and they gather here. But another thing is happening. Your smooth muscle cells also come up, and they grab your LDLs, and they also become foam cells. And then your smooth muscle cells also secrete collagen, which forms this fibrous cap inside your gut. So what happens is that you have your blood vessel, okay? And this fibrous cap ends up growing further and further and further inside your blood vessel, okay? And what does this do to your blood vessel? It's impeding all the blood that can flow through this blood vessel. And remember when we went over, where is it? Here. What affects flow? Flow equals pressure times pi r to the fourth. Then what also happens is that this clot, this fibrous cap, is unstable, and as it continues to grow, it pops right here. And then your platelets will come attached right here and form a clot, and eventually this will break off, flow downstream, and get stuck further down and cause ischemia. Who drew this? Carter?
Was it Carter?
No, it was not. Princess Diana.
Have you ever seen one with a heart attack?
Well, actually,
there was this one time.
Oh, hey, I just had a patient with chest pain, but she doesn't look very good. Can you see her now?
yeah, sure. Just give me a rundown of her
Yeah.
history.
So she has past medical history of hyperlipidemia and IBS. She hasn't had any surgery or hospitalizations recently. She's on atorvastatin 20 milligrams, but she doesn't seem to be taking it very well. She's allergic to bees and has an anaphylactic reaction. Her mom had hyperlipidemia and had an MI at age 66, and her dad has a history of hypertension. She currently is an accountant and follows an American diet. I asked her about exercise, but she said that really the only time she exercises is to get Dr. Pepper from her fridge. She doesn't use any alcohol or drugs, but she smoked a pack and a half a day from age 25 to 40.
Okay.
I asked her if she had any recent stressors, but she said her dog Pookie Wookie's on its last leg, so she's pretty worried about him. I did a review of systems and basically only found shortness of breath, 1 episode of vomiting, and some chest pain. Everything else seemed negative. Her vitals were 138/78 for her blood pressure, a heart rate of 100. Her temperature was 98.3, respiratory rate was 22, oxygen saturation was 96% on room air, and her BMI was 54.
54.
Yeah, she's in there.
Oh my God.
Hey!
Hey, how's
Hey.
it going?
Oh, it hurts, doctor.
Oh my God.
It hurts.
Okay, all right. What's going on here?
My chest, it hurts really
Your
bad.
chest? Okay. Oh, you don't look so good.
I'm just so hot. I'm sweating.
Okay.
I can't breathe.
You want a blanket?
No! No, it's hot.
Okay. All right. You said you're having chest pain.
Yes.
Okay. When did this pain start?
It started about 2 hours ago.
2 hours ago. Okay. And where is it located on your chest?
Right here, doctor.
Right there. Okay.
Right here in
And-
my chest.
And for the whole 2 hours, has it been like constant or has it been coming and going?
Constant.
Okay.
Constant.
Okay.
I was walking, I was just at work doing my own thing, and I was walking like I always do down to the vending machine to get my Dr. Pepper.
That's important. Yes,
I
ma'am.
do it every day, and it's usually fine, but today, right I got my Dr. Pepper. It hit me, and it hurts bad.
Oh man.
It still hurts. I can't breathe.
Okay. What does that pain feel like?
It feels like an elephant on my chest.
Oh my gosh. Okay. Has there been anything that you've been able to do that make it feel better?
Not really. It's a little bit better when I sit down, but it's still pretty constant.
Okay. How about anything that makes it feel worse?
Not really. It all just feels bad, so bad.
Okay. Does the pain move anywhere, or does it just stay in your chest?
Yeah, I did feel some tingling in my left arm.
Your left arm. Okay.
My jaw kind of hurt a little bit earlier, but
In your jaw. Okay.
I didn't think anything of that.
Okay. Well, that's not good.
Yeah.
How about what were you doing when the pain started? You said you're getting your Dr. Pepper.
My Dr. Pepper, my Dr. Pepper.
Your Dr. Pepper. Okay.
Yes.
All right. That's important. Dr. Pepper. Okay. And on a scale of 1 to 10, 10 being the worst pain you've ever felt, how bad? Where would you rate that?
10.
10. Okay.
10.
All right. 10 out of 10.
I never felt anything like this before.
Okay. All right. So I'm gonna go order a troponin on you, a CBC and a CMP, also a BNP, and I'm gonna go take a look at the results on the EKG they got on you earlier. Okay.
Okay, doctor,
All right.
thank you.
Okay. You're welcome.
Not a P wave.
Because there's no P wave.
But like how is it not a P wave?
Because if you look at it, it's just simply static. It's not there.
But it's a P wave.
Hey, Marcus, please. I
Yes,
need
sir.
your help. Okay. So I got a patient in the other room, and she's super sweaty, so I'm getting really sweaty. She's in acute distress. She's tachycardic, no murmurs, gallops, or rubs, or heaves, or thrills, or anything like that. Her lobes are clear to auscultation bilaterally. There's no JVD, or no bruits, no thyromegaly, no ascites, no hepatomegaly. There's no peripheral edema. She's normal on neuro exam, and her fundoscopic exam is normal, and her chest pain was not reproducible. And here's her EKG.
Well, when it comes to looking at this, the first thing that you did not do right is rip the top off.
I didn't rip the top off. There you go.
Good. Now we can move on to the next part.
Okay.
So, when it comes to looking at this, we're going to be looking for an ST elevation, and it's obviously right there because of a 1 millimeter increase just right there. And so when it comes to seeing that, it's obviously a STEMI. So with that, we're going to do an immediate treatment of the patient, and I believe her name is Elephant, right?
That's right.
Okay, so we're going to start with Nabash, and that's going to include a nitroglycerin, which will be for her pain relief, specifically her chest. We're also going to give her aspirin, which she does need to chew. It's going to be 325 milligrams. Stat, actually. We're also going to start with beta blockers for the anti-ischemia. I'm going to also go into an ACE inhibitor so that we can stop the apoptosis during that event. A statin for her hyperlipidemia. And last but not least, heparin so that it can stop the coagulation. And given that we're going to need an immediate treatment of her, she needs to go to the cath lab immediately. I want her to go through an angioplasty with a stent. During that treatment, I want to make sure that she is both on heparin, or not heparin, bilirubin. I want to switch heparin to bilirubin, and aspirin as well. And then during that procedure, she's going to be, after the 6 to 12 months, I want her to take aspirin for 325 milligrams and the Plavix as well. Again, she's going to be taking that for about a year. And then in terms of long-time treatment after that year, we're going to change aspirin to 81 milligrams, and we're also going to change Plavix to at least a year. So after a year is done, stop that. We're also going to have her on beta blockers for life, high-dose statin for life as well, and last but not least, an ACE or ARB if she has hypertension, chronic kidney disease, diabetes, and HFrEF. Do you have any questions for me?
Can you say all that one more time?
In order to avoid another visit from me, Miss Elephant needs to make a few lifestyle changes. So first off, her diet, she needs to cut back on the Dr. Peppers. Second of all, she needs to increase her exercise. So start small with a goal that's attainable and then move up from there. She also needs to be consistent with her medication taking. So recommending to her to take it while she's brushing her teeth or something that she does on a daily basis to help her remember. She should also follow up with her cardiologist for long-term care, and she should establish care with the PCP. And lastly, she should continue her smoking cessation.